Hi, my name is Gayatri Ramprasad, and welcome, Vikram, to Conversations on Hope and Wellbeing. I'd like to just take a few moments to just give a bearing about who Asha International is and who Vikram, our amazing guest today, is. As I mentioned, I am the founder and president of Asha International, a nonprofit organization dedicated to normalizing conversations about mental health and inspiring hope and well-being, one story at a time. Over the last few months, the COVID pandemic has impacted and upended all of our lives, impacting every single aspect of our life and our livelihoods, including mental health. As the number of cases of COVID-19 increased, so did the associated experiences of anxiety, depression, and suicidal ideation. At Asha International, we know that the mental health effects of COVID-19 are as important to address as are the physical health impacts. And it is equally important for all of us to address the inequities in access to care. Today, I'm delighted to welcome Dr. Vikram Patel to share his insights on how to ensure mental health for all. Dr. Patel is the Pershing Square Professor of Global Health in the Blavatnik Institute's Department of Global Health and Social Medicine at Harvard Medical School. He's a co-founder of Sangath, an Indian NGO, which won the MacArthur Foundation's International Prize for Creative and Effective Institutions in 2008, and was listed in Time magazine's 100 Most Influential Persons of the Year in 2015. His accomplishments are far too many for me to mention. I've had the privilege of knowing Vikram over several years and truly admire his dedication to ensure that everyone, everywhere, has access to mental health care. Hi, Vikram. Welcome to Conversations on Hope and Wellbeing. Thank you so much. I know it's early in the morning in India, so I'm very, very grateful for you taking time in your very busy life to join us today. How are you coping with the pandemic?
Well, thank you, Gayatri, first of all, for inviting me. And thank you for starting the question by asking about myself, which I think is what every conversation around mental health should really begin with. It's not about the other, but about each and every one of us. So, to be honest, it's been a bumpy ride. It's been now, I'm trying to count, at least nearly coming up to 5 months since my plans to return to Boston and start my semester with my students was upended when the medical school shut down. And I found myself partly stranded, partly out of choice, remaining in India, where I also maintain a home. So the plus side was that I actually got to spend a lot more time with my son, who had just finished university. And it was the first time in 5 years that we have actually spent such a long time together in the same home. And I've really enjoyed that. There's been many other things I've enjoyed. For example, bonding with my new dog. We become the best of friends, and I've really enjoyed the experience of loving my dog. And of course, there are many other things, spending time as a family and enjoying the neighborhood. I live in a beautiful village in a small part of India called Goa. So all of those are obviously the positive ways which I've been able to turn what was initially a major disappointment around into something that's been very life affirming. That said, of course, the uncertainty, especially of not knowing exactly when I'll be able to return to my colleagues, my students, the other world and life that I enjoy in the US, of course, continues to play on your mind. Just when you think things are going to improve, they actually get worse, as I see both in the US and in India right now with the pandemic. And so the pole of uncertainty continues to affect my mental health. And I have to constantly deal with that. I have to constantly challenge the feelings that this arouses, the distressing emotions that this arouses. And hopefully I've seemed to have found the right mix of exercise, of spending time with the family, of engaging in fun activities and so on, that keeps me, as it were, on an even keel.
Thank you so much. Isn't it true for all of us? As difficult as the last few months have been for all of us, it is through social, just self-care first and foremost, and social connections, the social support, that each of us are finding some semblance of being centered, being balanced. So thank you. We're already seeing a growing impact that the pandemic is having on the mental health of people across the world, across all age groups. And so can you share some insights on the situation from your vantage point, which is really a global vantage point, and how we can address this situation, which certainly is going to have a huge impact on the mental health of our global community for years to come.
Yeah. Well, you're absolutely right, Gayatri. The question is, we need to have a long-term horizon here when we talk about mental health. I see the mental health consequences of the pandemic playing out in really two overlapping phases, and I think we're very much in the first phase right now in most of the world. Say, for example, in Latin America, Asia, and Africa, South Asia in particular. When I talk of Asia, which is that the epidemic is still actually spreading. Every day the numbers of people infected and numbers of people who die is constantly growing, and so it's clear we're nowhere near the end of the actual epidemic at the moment. We're right in the midst of it, actually, if we take a global perspective. And so at this acute phase, of course, the biggest mental health concern is that of the fear of the virus itself. Fear of contracting the disease, fear of dying, fear of loved ones and relatives and friends, etc. And in association with that, the specific strategies to control transmission, the effect that has on your mental health, things like physical distancing, quarantining, and so on. The next phase, which has already begun in many parts of the world, of course, is the economic consequences of the pandemic, both in terms of the lockdown, but those are really temporary periods of the complete cessation of all economic activity. The truth be said, there's going to be a very, very long time before people begin to return to the sorts of everyday life choices and behaviors that we had before the pandemic. And as a consequence, many economic activities are going to remain either completely closed or be very, very slow in the months and years ahead. And that, of course, we can already see is affecting the employment prospects of literally tens of millions of people, in fact, hundreds of millions of people around the world. Now, we know that those sorts of acute economic difficulties are associated with the rise of mental health problems, particularly mood and anxiety disorders, but also substance use conditions, and ultimately suicide. We've already seen that play itself out after the 2008 economic recession in the US, where life expectancy of working age Americans actually fell in some parts of the country, driven by what's called the deaths of despair, suicide and substance use related mortality. This time, Gayatri, the economic recession is imaginably worse. Not only does it affect the US, but it affects the whole world. And many parts of the world which it affects do not have even whatever social welfare security nets exist in the US. So I really fear for the long-term mental health of the world's population, but I also therefore see this as a historic opportunity to transform and reimagine mental health care.
And how can we do that, Vikram?
Well, I think in a nutshell, it is to actually move away from narrow binary biomedical models of mental illness. When we talk of mental health, let's be quite honest, the vast majority of people immediately think of mental disorders, diagnoses, and drugs, what I call the 3Ds, doctors, diagnoses, and drugs. And we have to actually move away from that narrow view. That view is important, but only for a certain group of people in the population who have those kinds of needs. But the vast majority of people also need their mental health to be cared for. And for those individuals, we do not need the 3Ds. So I think to embrace the plurality of the experiences of mental health that defines each and every one of us at every point in our lives, and therefore also the diversity of experiences and interventions and strategies and approaches that we can use to promote mental health, to prevent mental health problems, and to help people recover is really what I think is the historic opportunity for a reimagination of mental health care.
I couldn't agree more with you, because for most of us, even today, when we say mental health, it is these images of very severely ill and people in the chronic crises in terms of their mental health. It's not, the discomfort, the stress, the overwhelm that we feel from day to day, and especially during these difficult times, and finding it hard to manage. It's a spectrum, much like humanity is a spectrum. Mental health, I truly have learned in my own life that it is a spectrum, and on any given day, we're at some point on that spectrum. And so it's so important for us to care for it actively every single day, much as we care for our physical health, and we should be caring for our social and spiritual health and economic health and all of the other aspects of health and well-being. In addition to ensuring access to mental health care, it's really important for us to think of integrative care, you know, integrating the mind and the body and the spirit. I know you have a personal story that taught the importance of integrative care in your own life. And I know that you've been advocating for integrative care. It's not mental health or physical health, it's both, right? So can you share a little bit about the story and how you have been championing integrative care in all of the work that you've been doing?
Yeah, Gayatri, you're right. You're referring, I think, to the story of my mom, who, battled with mental illness and medical conditions for pretty much all of her life. From her very young adulthood years, particularly depression in the early years. And on the mental health side, it was mainly depression in the earlier years, followed by alcohol addiction in the later years. And these two kind of played with each other, as they often do across a person's life course when you have depression or alcohol abuse together. But she also had very serious chronic medical conditions, such as, for example, diabetes. And I think really the big lesson I took away from watching my mom was how terrible her care was in terms of the focus on specialist approaches to care, which only focused on one of her concerns, one of her health needs, in complete ignoring completely all her other health needs, even though these were completely interacting with each other. It was almost like the specialists thought the human experience of physical and mental health was siloed in the way medical textbooks are siloed. It was absurd. But unfortunately, this is a fundamental problem of medical education, is that we have actually created this siloed approach through our education system, and also through the incentivization of specialist approaches to care. So every young doctor, most young doctors in India, for example, want to be cardiologists or gastroenterologists or neurologists. They want to focus on one part of the body. And of course, family medicine, primary care, general practice, nursing, these kinds of much more holistic approaches to health have been completely devalued. And I think a key element of integration is not only recognizing the mind and body are inseparable. Of course they are. I mean, even the specialist physicians will agree to that. But also to translate that realization to where you really allocate resources in the healthcare system. And in my mind, the emphasis must be on primary care and community-based approaches, because that is where person-centered, holistic, integrated approaches to care would be most feasible. So in the case of my mom, if I had to turn the clock back, what I really wish she would have been a great primary care practitioner, particularly one who also had home-based nurses or nursing assistants who would visit my mom as frequently as she needed and provided her holistic care in her own home, and also embraced, beyond even just narrow medical approaches, perhaps some other areas of health promotion that she was very passionate about. For example, she was a deeply spiritual person, and it would have been terrific for her to be able to combine all these different approaches in the way that she understood her health and well-being. Unfortunately, that never happened for her. And indeed, it doesn't happen for most people in the world today.
Well, I'm so sorry for your mother's suffering, but I'm also glad that, given the circumstances, she did have access to care, and she had a wonderful son and a family.
Oh, yeah.
That loved and cared for her deeply, which again isn't the truth for a lot of people in this world. So, my love and my respects to all of you in your family as well. I was, however, one of those lucky people, Vikram, because although at the worst of my struggles through depression and suicidal ideation, I was here in the US. And, when I was confined in the seclusion room of a psychiatric ward here at the local hospital, I had the incredible fortune of meeting a resident who was training to be a psychiatrist at the hospital, who took the time to get to know me, to connect with me, and to sit down with me and share with me that, the medical model had its misgivings, it had its failings. And while the medications and the hospitalizations had not helped me as yet, he was the person that, introduced me to the art of the incredible life-affirming practices, which I'm sure your mother would have benefited from and would have loved to. The ancient practice of pranayama, of transcendental meditation, of yoga. So here was a white American physician here in America who could barely even pronounce the names pranayama or transcendental meditation or yoga correctly. But he is the one that introduced me to these incredible healing modalities, which the practice of which for the last almost, 3 decades of my life has completely transformed my life. So I couldn't agree more with you for the need for holistic, culturally responsive, integrative care, right? I mean, every culture has its barriers to health and wellness. And every culture inherently in it also has incredible pathways to health and healing. And I am so glad to hear a physician and a healthcare practitioner like yourself, see the value, see the value in all cultures, in all modalities. So thank you for sharing that. At Asha International, we believe that our stories are our superpower, and we empower people with lived experience, whether it's with mental health issues or substance use issues. We empower people with lived experience to share their story, to inspire hope and ignite change. What do you think the role of people with lived experience is in transforming mental health care?
Well, Gayatri, that's a terribly important question, and I've given a lot of thought to this. In my mind, I'm very heavily guided by the disability movement here. More generally, the disability movement that has this incredibly moving slogan, "Nothing about us without us." And I think to me, that really underlines the importance of the lived experience in all matters to do with mental health. From thinking about what should the mental health care system target, what are the priorities and needs that are felt by people with mental health problems, rather than the clinical approach that only focuses on symptoms, all the way through to being involved with designing care, to delivering care, and of course, most importantly, to holding care accountable. But beyond the care process, I think there's no question that the engagement of people with a lived experience is the most effective strategy to address the public understanding of depression or other mental health problems, to address stigma and discrimination. We've seen this with many other health conditions, by the way. For example, HIV/AIDS. Remember there was a time when HIV/AIDS was incredibly stigmatized and feared. And if you have to look back and think, what were the different things? Lots of things were done to help destigmatize HIV. But one of the things that was most effective was the person with a lived experience, the person with HIV standing up and say, "Hey, I have this disease and I live in your community and I'm someone I live in the same community as you," etc. And it's that kind of normalization that this is a condition that could affect anyone in the community. It has no bearing on a person's personality or characteristics. And just like any other disease could strike you as well. And I think that normalizing that experience through the person with the mental health problem becoming center stage in stigma and discrimination combating activities, I think is the most effective strategy of all.
I couldn't agree more with you. Given the truth of the power people have in sharing their stories, we also understand the barriers, the fear for people to share their stories. We talk about the stigma and the shame that surrounds mental health conditions and the real consequences that people are afraid in their lives and their livelihoods. So given these circumstances, what is your call to action to people with lived experience around the world? What would you say to someone living with a mental health condition, for example, in India or in Africa or in America or anywhere in the world? What would you tell them? How would you inspire them to stand up and share their story? Because it is so powerful and the time is now. We don't have time to waste. The time is now to end stigma and to save lives. So what would your words of encouragement and support be for people with lived experience to stand up and share their stories?
I think my message would be that never before in our modern history has there ever been a time that is more opportune to transform the mental health care system, to make it much more person-centered.
Yeah.
And never before has, therefore, the importance of the lived experience been as relevant. It's also correct to say that never before have public attitudes to mental health issues been much more as open as now, partly because the pandemic has led to an overall increase in distress across the population. And there is a very healthy and a positive conversation happening about mental health right now that is moving away from narrow binary models. This is the time. This is the time to gather up your courage, to have faith in the humanity of people around you, to appreciate that most people, not all, but most people is enough, will embrace you
Yeah,
for your courage and will embrace you with dignity that
yeah,
you have had the opportunity to speak about your mental health difficulties and always combine those stories with stories of recovery. Because, of course, every struggle is also associated with moments, if not extended periods, of recovery. And those are the ones that I think are the most inspiring of all.
I couldn't agree more with you. I just want to share a couple thoughts on that. First of all, it is that it's the incredible resilience of the human spirit, despite our struggles, whatever they may be, that comes through these stories. I've had the privilege of, recording nearly 175 stories of courage and resilience from around the world. And every single time, it takes my breath away to listen to a story of struggle, of courage, of hope, and of resilience. And even in my own life, the way I learned that my story was my superpower was through overcoming the fears of what would happen if I stood up and shared my story. Will people ostracize me? Will they ostracize my family? What would happen to my husband's future or my children's future? And all of these worries that plague all of us. And yet, for the most part, not all, but for the most part, like you said, people have embraced me with love, with compassion, with support, and with humanity, and restored my dignity within myself and my hope in humanity again, right? So it is important. It's important for all of us to have faith in humanity and courage and faith in ourselves and our ability to be part of this movement to transform mental health care. And, I, at a time in my life that I was still venturing out as an advocate into the world, I had the privilege of meeting you, Vikram, in my hometown, Bangalore. And that was the first time I had the opportunity to meet you. And you restored my faith in humanity. You restored my dignity within myself and the hope and the courage to do the work that I have been doing over the last couple of decades. And so I cannot thank you enough in a world where there is divides of all kinds, and certainly the divide between a patient and a provider. You bridged that gap and you met me as a person with potential. And that is where the power is for each of us to meet another as people, as equals, and honor and cherish each other's humanity and support each other in our walk through this life. So thank you for that gift that you've given me.
Thank you, Gayatri. That's a very, you remind me of that wonderful day as well in Bangalore. And I also want to thank you for your unstinted courage and advocacy. You are a role model, really, for people with a lived experience to be able to stand up and do something with their experience that can transform lives. It isn't the case that everyone needs to do that, by the way.
No.
And I don't certainly want to imply that that is needed from everyone, but at the very least, to be able to share your experience with those around you, close to you, I think would be the sorts of small little acts of kindness and generosity and transparency and sharing, storytelling, really, which could ultimately, in these small little ripples, ultimately change the entire ocean.
I completely agree. Vikram, you have had the opportunity to live and work around the world, and you've been a part of and aware of many programs and protocols that are compassionate, that are effective in providing comprehensive integrative care for people. Can you tell us a little bit about some of the programs and some of the interventions that you find helpful?
Yeah, let me tell you a couple of examples. There are many that I get inspired by. I work with amazing people, Gayatri, really amazing people. And my greatest fortune in life has been the mentees and colleagues that I've had the opportunity to work with, both in the US and in India, but also in many other countries of the world. I find myself privileged to work with people actually in many, many parts of the world. And I think through them, I've learned a couple of things that, and my own work, that I've learned a couple of things that are really powerful motivators for me in the work that I do in the years ahead. The first is recognizing the importance of the environment in shaping our mental health. And as a concrete example, I really look at the environments in the first 2 decades of life, particularly the parenting environments in homes of very young children, and how that shapes early life brain development, cognitive development, which in turn affects learning achievement. And of course, it affects our mental health. And the second is the social environment of schools, which is potentially the most powerful mediator of improving well-being and mental health in adolescents and children who are in schools. These are two great examples of where you demonstrate that interventions are not targeted at the individual, as it were, to promote their own mental health, but at the environmental determinants that shape the mental health, as I said, particularly of vulnerable phases of the life course, that is in the first 2 decades of life. And the second kind of work that I find very exciting is the ability to demonstrate that that anyone with the right training, with the right supervision, and importantly, with the correct kind of intervention, can deliver psychosocial interventions to great effect in improving recovery in people with mental health problems. Now, this is really exciting because what it suggests is that instead of the kind of typical conversation that we used to have, that is to say, we don't have enough resources, and typically by resources in the mental health sector, we meant skilled human resources, mental health professionals. We can now change the entire conversation into saying, how do we use the resources that are available in every community? How can we leverage and deploy existing, available, accessible resources to become partners in addressing mental health in the population?
That's a great transition to tell us a little bit about your work through Sangath. Would you tell us about your work through Sangath, and perhaps one story that you find most inspiring?
Yeah, absolutely. I mean, so what I've described in a moment ago is very much part of my work in Sangath. We work in schools. We work with for adolescents. We work with parents of very young children to promote mental health and prevent mental health problems. And then with adults with mental health problems, we work directly with community health workers like the ASHA worker, which of course is the name of your organization in India. The ASHA worker, ASHA means hope, of course, as I'm sure your viewers are aware of. But it also means, it's an acronym in India for a particular group of community health workers, more than 1 million actually in the country, making that the largest single public sector workforce in the country. So a lot of our work is around now scaling up these interventions through ASHA workers. And we're very excited about our use of digital platforms to train ASHA workers, to provide them with supervision so they become masters in the therapies that they've learned, and then to use, again, digital platforms for quality assurance and for improving the effectiveness of the overall mental health care system. So that's something which is going to keep me very busy in the years ahead. Really, the scaling up of the small pilot and demonstration projects that Sangath had led, but also which has been replicated by many other groups around the world, to really take them to scale. And excitingly, Gayatri, we're doing this in the US as well. So this is, for me, a really extremely disruptive. We're taking innovations that were developed in low-resource countries and bringing them home to the US, deploying exactly the same approaches, the same digital platforms, and so on. And so that's something which for me is a personal story of great excitement as I look forward. It truly brings the global mental health into play, because by globe we mean every country in the world, and that includes high-income countries, high-resource countries, which I believe have also very, very underperformed when it comes to mental health care, and they can learn a lot from the innovations in low-resource countries.
Absolutely.
So to me, that's a personal story that I'm particularly excited about.
I couldn't be more excited, and I'm so happy that you're bringing it to my second home, the U.S. And this is amazing. It's so good to hear about it. Can you walk us through the process of how a person comes into the ASHA program and becomes the community health worker that they are and offers care?
Well, let me just say more generally about the program that I'm referring to is called Empower, and essentially what happens is we work with implementers directly. So in the U.S., we're working with the Meadows Mental Health Policy Institute in Texas, which in turn is working with a number of different hospital systems that it supports. In India, we're working with state governments who employ the ASHA workers. Essentially, we as in from Harvard Medical School or from Sangath in India, are technical capacity building organizations. Those are our roles. We identify interventions. We create the digital curricula using a very systematic process. The interventions we choose are the ones that our implementers want to prioritize. And so for now, we're looking at foundational skills for delivering psychological interventions. The next one is a treatment for depression, a 6-session behavioral activation treatment. And we're also looking at psychological first aid and crisis counseling. So these are going to be our first offerings. And essentially what happens is once those offerings are available on the digital platform, health workers from these implementing partners would actually be identified by them. They would come online. They would complete the courses. They'd complete a competency exam that we have also designed, of each specific to a particular course. And then they will enter into a phase of case-based learning in which they would actually start seeing patients. We'd use quantifiable quality metrics, which again, we as a technical agency have developed and validated. And then once they've completed that, they would then become credentialed to start providing care, after which we have a indefinite continuing professional development and quality assurance cycle that's built in to the care delivery. I want to just end by saying, Gayatri, this is the base of the pyramid. We're not placing specialized care. We're extending the footprint of mental health care into the population to reach the unreached. And in doing so, we're also extending the incredible innovation of using community-based providers to deliver low-intensity psychological and social interventions to the large proportion of people with mental health problems who will benefit from just that and nothing more.
Yeah, well, and it couldn't be coming at a more opportune time in the world, and certainly even here in the US. So thank you for everything you do. Just some final few questions for you. What inspired you to pursue a career in mental health?
I think, well, mental health was mainly because it was the only branch of medicine I found that seemed to have any interest in the person. I have a very fond memory of, I was very interested in the brain always. That was the chosen organ, as it were, as a medical student for me. And so neurology was the respectable option to go for. And essentially, I was just very disillusioned by, my experience in neurology, where the interest was entirely in the diagnosis, and often the diagnostic procedure in neurology was like a piece of theater, the whole physical examination and so on. And at the end of that, you'd get a very captivating sounding diagnostic label like Friedreich's ataxia, which would really charm any medical student. But of course, there was never any interest in the person because there was no treatment for most of these conditions. And on the other hand, in psychiatry, I've witnessed a very different kind of approach where the interest was in the person. Who do you live with? What do you do for a living? What's been your childhood like, etc. And so it struck me as a far more humane aspect of medicine, one that was much more person-centered and actually also much more socially conscious, because psychiatry was one of the only disciplines I saw in medicine that explicitly embraced the idea of social determinants of health. I've been a little disillusioned since then, and so if I had to ask you had asked the question, why am I doing what I'm doing now? I would say that I believe that sadly psychiatry has lost some of those very important moorings. Its firm grounding in the personal story, that of course was best exemplified by psychotherapy, as well as its firm groundings in social determinants that was best exemplified by social psychiatry. And certainly I see global mental health, the field that I embrace, as really trying to reinvigorate these historical roots of psychiatry and bring them back into mainstream play. And I'm really thrilled to see that that is exactly what is happening now.
Yeah, that is exciting indeed. So what gives you hope, Vikram?
Well, what gives me a lot of hope, particularly in this particular area, there's a lot of reasons why I don't have hope, but I'm not going to go down that route because, that's not the purpose of this conversation. But if I had to focus on mental health, I can just again draw from my own story. 25 years ago, I would never be asked what I do the moment I said I worked in the mental health sector or I was a psychiatrist. That would be the end of all conversations in, dinner parties or with friends or family. Today, it's exactly the opposite. Today, it's exactly the opposite. People ask me, oh, that is so interesting. This is such a relevant issue. Tell me more about what you do. I have never felt more, never felt my work is more relevant. There's more demand for the work that I do, and indeed what others do in mental health, than ever before. To me, that's hope. It's a long time coming that we needed this kind of need for, this demand for information and action on mental health. And I see this as a tremendous opportunity, Gayatri.
I do too. Thank you for your time. And one last question: what helps you stay resilient, Vikram?
Well, there are many things I do, but amongst it's not a one thing, but I'll say a few things. The most important things in my life are spending time with my wife and my son, and where I can with my family who don't live with me, but I make a huge effort for being with my dad, who's now 86 years old. And I want to just stress that I'm not doing this for them; I'm doing it for myself. This is not charity; this is actually self-preservation. The second is exercise. I'm a complete addict for swimming, and I've discovered over 30 years that actually this keeps my mental health very stable. And so I make it a point, whether it's cold weather or hot weather, makes no difference. I'm out in the pool at least 5 times a week. And thirdly, by engaging with my work. I actually find my work tremendously stimulating. I find that I'm very fortunate, actually, that I'm able to pursue my heart. And so that's been a very lucky break for me in my life, that I do what I love doing. And that obviously always keeps my mental health in going. It preserves it, it promotes it, makes me feel good.
I completely agree. You and I are both lucky that our work is play. It's something we look forward to, waking up every day and doing it and being inspired by it and being fulfilled by it. And there couldn't be a greater gift. There couldn't be a greater gift. So thank you for your time, Vikram. You're so generous. Thank you. And I wish you the very best in all that you do to ensure mental health for all, everywhere, for everyone. Thanks again.
Thank you.
Goodbye.
Thank you, Gayatri. The same wishes to you too. Bye-bye.